Aloha, I am Mark Alexander, Executive Director of the Hawaii Medical Association. Thank you for joining us for today's presentation with Dr. Elizabeth Ignacio, who will report on the just completed session of the Hawaii State Legislature. The format tonight will be the following. We'll have a presentation for about 15 minutes. After the presentation, we'll move to the question and answer part of the program. For those in the room, we invite you to submit questions on the index cards throughout the program. Those who are participating via Zoom, we invite you to use the Q&A function on the Zoom program, and you can make comments and submit questions throughout our program. In addition, we have received a number of questions from HMA members prior to this evening's session. Many of those have been integrated into the presentation that Dr. Ignacio will be offering. After this time of Q&A, we will end the formal part of our program, and then we will continue the conversation here on site. We plan on ending our formal part of the program by around 6 p.m. It's now my pleasure to introduce our speaker, Dr. Elizabeth Ignacio. She is an interventional radiologist based on Maui, and she's president of HMA, having served on the board since 2022. She's also past chair of the Public Policy Committee of the Hawaii Medical Association. She, along with HMA Public Policy Chair Dr. Gerald Garcia, testifies frequently before the Hawaii State Legislature. She is also HMA's alternate delegate to the American Medical Association. We're proud and happy to have Dr. Ignacio with us this evening.
Aloha and good evening, HMA doctors. I'm very excited that we've gone through the session and there have been some great bills to come out. So I'm going to spend some time going over some of the highlights. I have a few slides to share, and I will be relying on my peripheral brain. As you can see, there's a lot of content to cover, and I want to be able to answer all the questions for the folks here at our office as well as there online. So please bear with me while we collect all of the details in some of these questions, but we're going to just go through our reflection of the 2025 Hawaii legislative session. So if you could please advance. I always like to start our discussion of advocacy with our mission statement. I think in this very busy life that we have and all the work that we are doing to take care of our patients, we want to keep that North Star of patient care, quality, and safety up there for our Hawaii community. So I'm grateful to have worked this session with our public policy chair, Dr. Jerry Garcia. And we can go to the next slide, please. Thank you. I do also like to highlight what has been our legislative priorities for this session. This is always great for a look back so that we can assess like what we set up as our goals, our objectives, and were we true to these ideas? Did we keep focused? And what have we accomplished? What work still needs to be done? As you can see, we have gotten the opinions of our members and the survey every fall right before the session to check things out and to see what people consider the priorities for our community, for our patients, and for our physicians. And we try to prioritize them, make sure that when we're looking at our measures that we are keeping these in mind. There's millions and millions of issues that we can address in the healthcare world, but we have limited resources. We got to save our gunpowder for those battles that are really important to our physicians and patients. So I just like to post that there as just a reminder of what we considered our priorities for this session. Thank you. So hooray, yay. I'm very excited that we get to talk about prior authorization and the bill that passed, HB 250, which we were so excited about. We worked very, very hard on. This has been a long time coming, and I want to thank everyone here in the room. We have our public policy core here, as well as Representative Lisa Martin If you want to, you can join us up front here, but we're so grateful for our policymakers, all of our stakeholders, our interest groups, community advocates, hospital. This was an amazing and incredible lift, and we're deeply grateful as Hawaii physicians for the synergy that's happened for prior authorization in Hawaii. Welcome.
Thank you.
Thank you for your hard work on this. I'm gonna again rely on my notes because this was a very detailed effort and build. There were a lot of moving parts on it. I'm using my notes here. Apologize while I go over this, but the HB 250 that we're all celebrating tonight will require utilization review entities to submit data relating to the prior authorization of healthcare, and the State Health Planning and Development Agency will establish the healthcare appropriateness and necessity working group. Within the State Health Planning and Development Agency, we're going to have that group and submit annual reports to the legislature. The bill actually goes through the specific points that will be in that report. Very important that we'll be reviewing standards of care. We'll be looking at evidence-based criteria, and we will start to chip away and hopefully diminish what is a very burdensome process for patients for prior authorization. And I'm so grateful for you being here tonight. Thank you for being here, Representative. Mahalo nui loa from all Hawaii physicians for your hard work on this measure. Did you have some points that you were really focused on when it came to this measure? I know we're kind of improvising here and maybe you weren't planning to talk too much. It's been a long week, but I'd love to hear your thoughts on what you consider the very important parts of this measure as you brought it forth.
Okay, so I heard about this. My friend's daughter, Liza Brooks, who's a medical student at UH, she did a study on this. So I was aware of the issue from the physician's point of view. Obviously, from the patient's point of view, I'm also very familiar, thankfully not through personal experience, but through stories of others of, unnecessary delays in healthcare and leading to worse outcomes. And there was tragically even such a situation in the offices at the Department of Health where there was a death while waiting for a device. So from both sides, we want to keep our physicians here. We want to make our physicians happy. And this was identified, as you know, in that survey as being the #1 burden, not only in administrative costs, but also in not being able to provide their patients with the standard of care that they are trained to do and that they want to provide. So anyways, that's why I thought it was important. We really could not have done this without Jack Lewin, the Department of Health, because this bill has no money attached to it, right? He's willing to take this on. We also couldn't have done it without HMSA coming around, right? Absolutely. They were a little nervous at the beginning, but they really came around. They are already taking some steps within their own organization to move towards automation. And I think the goal of this working group is to review, are there some things that for which prior authorization is required that really shouldn't be on that list anymore? Because maybe the standards have changed, medicine has moved. Are there things that we can attach to a certain association, depending on what the disease is, the professional association that should go with, and permanently attach it to their recommendations so that it's not a black box. People know exactly what the standard is, what what criteria their patients need to meet. And then once we have those set up, then the next conversation can happen, which is not part of the working group, but the next conversation would be to automate, so that a patient could go into their doctor's office and they could know whether they qualify or not before they leave.
Before they
leave, right? So, and then the other thing is to have a conversation about a reasonable turnaround time. And the last thing is I know a frustration for physicians is when there is a denial, which are usually then overturned, the person that they're speaking to about that denial may be an administrative person with no healthcare background, and they're frustrated because they are not talking to someone who speaks their language. And so having standards for the person that they have to try to reason with about a denial that they think is inappropriate. So kind of addressing all those issues. This bill doesn't solve any of those. It's just a first step. But if, you know, if we do move the way we want to move, we will be a model in the nation for how to address this collaboratively. You know, the insurance agencies, they don't win with prior authorization. They're paying a for-profit third-party provider. If their clients get sicker, they're paying more for the healthcare. So this is an all-around lose situation that hopefully everybody will work together to, you know, to make it something better. I was very long-winded.
No, not at all. And this is a very complicated process. When you compare Hawaii as a state compared to the other states for prior authorization legislation, we were kind of behind already. There were many states that already had 4 or 6 rules, definite prior authorization rules that they were able to apply in terms of the tenets that are accepted by the American Medical Association and other professional organizations that are needed to reform prior authorization. And we really had nothing definitive on our books. So as you guys are aware, there are, you know, for physicians, primary care as well as specialty care, physicians can spend up to 8 or 10 hours of work time going over prior authorizations each week. And they do about 40 prior authorizations every week. That's 40 patient issues. And some of those issues are chronic, long-term issues that don't even change. And you still have to re-up the prior authorization. So there's a lot of work to do. And that wasn't a long-winded answer because it is such a complex process. This is a first step. It's an important step because I think it's bringing together all of our stakeholders, all of our interest groups together on this committee, this work group. And it's very exciting, even though we don't, as Hawaii, we didn't have like a lot of regulations on our books. When you looked at some of the ones that were on the books for other states, a lot of them weren't even that effective in addressing the problems of prior authorization. I feel strongly that this collaboration is a great way to leapfrog forward in this whole solution process. And so I am hopeful. There's still a lot of work to do. And I'm really grateful for the collaboration of HMSA, of our other healthcare advocates, the hospitals, the hospital systems, the community systems, some of our strongest advocates in our own organization, the Hawaii Academy of Family Physicians, Dr. Carlisle, Dr. Christina Marzo. They were so great in giving us input on prior authorization, as well as our neighbor island physicians, such as Dr. Esser Smith, Dr. Scott Grosskreutz, and others. So it's been a long time coming, and it's a great first step. So I think we really do have reason to celebrate tonight. I also want to just thank our group here because, you know, physicians are very busy and trying to herd us all together to get some consensus like herding cats. So I'm grateful to our lobbyist and our executive director for bringing our voices together so that we could collaborate. It's a you know, a very fast race during legislative session and trying to get all the voices heard. It's tough. So I have no additional comments. I don't know if you'd like to make some other comments, Linda. Our lobbyist is here.
Yeah, just fine.
Yeah. I mean, our policymakers, our legislative champions have really worked hard on this as well. So we're grateful to you as well as our healthcare chairs, Senator San Buenaventura and Representative Greg Takayama. So grateful for listening to our proposals. We brought forth a couple of amendments that you guys paid attention to, and we're so grateful that we can keep this conversation going. So yay, I'm really excited about that work. Thank you everyone for the work on prior authorization reform. We can move to the next one if you like. I have a couple of different measures that I can highlight here. You're welcome to stay there or wherever you like. I'm again going to be relying on my bill for
You can definitely talk to the midwife issue.
Oh, great. Well, we could jump to that one ahead if you like. That one was a very tough one, and I'm scrolling down because there was quite a bit of content on that one. but that she's referring, representatives referring to HB 1194 on the midwives and the licensure of midwives. And if you'd like to comment on that, we welcome your comments.
Yeah, well, I don't know how familiar people who might be in a different specialty area. Obviously, our OBGYNs are very familiar with what has been happening here, but for others, they may not be. But we went through a very long period, almost 20 years, where people who were not nurse midwives were not regulated. So it was kind of just a free-for-all in the view of some people. For others, it was a renaissance, for birth workers. So there's different views. Definitely, excuse me, it's very hard to take something away from people once they have it, right? So 5 years ago, the wheels were set in motion to regulate, the profession of midwifery. And at that time, the bill that was sunsetted in 5 years, and it was not well written, it was not thorough, right? This was the permanent bill that we put in place this year, and it really gave a full scope of the profession for certified midwives who are primary care providers with a graduate level of education, and then also for certified professional midwives who are trained, but at a much lower level. It's more akin to maybe like going through a community college program for 3 years. But in these cases, the law that was written is very detailed. There, I apologize. That isn't your talk. Sorry. Yeah. So there are requirements for, updating your CPR every year, for ongoing medical education, for peer review. There's accountability. I have to say that some of us, including myself, were not happy with some of the amendments that were made towards the end. There is, in addition to going to an accredited institution to become a certified professional midwife, which again is the lower level one can do what is which is an apprenticeship path. And my concerns with that is if the teacher is not a great one, then the students will also not, have great information. And so that's so much reliance on the individual. And it could go well, but it does not go well. And so that was not my preference, but that is what, was in the bill that we were able to pass. But what makes me feel better is that person still has accountability. If there are problems, that person can get it. Yeah. And yeah, there is accountability. So if there are problems, if there are poor outcomes, there can be a review, there can be redirection or removal of license, something that we didn't have. For 20 years, there was no accountability for bad outcomes. Those bad outcomes were addressed in our hospitals. Those deaths they were recorded in the hospital, and we didn't even collect data. So I think that the bill it was a very long document. A lot of people worked on it for a long time to try to get it right. And I think it leaves us in a much, much better place than we were. There are community advocates that are not happy with it, that want us to have, to not regulate cultural care providers. We do have an exemption, 100% exemption for people of Native Hawaiian descent with no oversight whatsoever. And that is their right in our Constitution. But besides that, everybody would need to become licensed in our state.
This bill, when we were talking about it from different advocates, it was really tough because I think everybody's hoping to get something good in our regs, make sure that we've got something where there is clear statements. And I think everyone got at least a moderate piece of what they wanted in this measure. If not, they're not going to be 300% satisfied. And then there were other issues that I think a lot of us, like, darn, we really wanted to keep these pieces out of it. Overall, I think it's a reasonable bill. I know that our ACOG associates were okay with some of the changes. We wanted to make sure that there was some standardization, that we maintain quality and accountability, and I think that that is present in measure. I'm not crazy about the pathway for licensure, and we did submit testimony in that regard. It's not perfect.
Yeah, I'm not either,
But to
but
make sure that that standard stays even for our neighbor islands, especially where we're going to have less access to emergent care. That is where our neighbor island OBGYNs were seeing a lot of morbidity and mortality. And quite frankly, they were just having a really hard time seeing the outcomes in the emergency room. Very, very devastating for patients and their babies. So that's a tough one, and I appreciate you taking that one on.
yeah, I have to say that I was upset, but even with the amendments made, we still had, I think, 16 people vote against it on the House floor, which just shows you there is a huge range of positions within our body. And so this was a compromise, as are many things that happen in the legislature. It is a compromise, and it's not something that the proponents of no regulation felt that they would.
Yeah,
right?
absolutely. And that's going to happen. I think when you have a diversity of representation, that can be the good and bad of it. You're going to get a creative solutions, and not everybody's going to walk away from that negotiation 300% happy.
Can I, for the rest of your list, can I cede the seat to somebody else who may be
please.
more knowledgeable?
I'd be happy
And
to.
it's so lovely to talk to you.
Thank you
and
for
to
being
share
here.
those.
Really appreciate it. Thank you so much. Thank you, Representative. We can move along with some of these measures, and like I said, so much nuance to some of these measures. I'm going to talk a little bit about the telehealth one, and let me go to that one because I know that this is one that's very concerning for physicians and their patients, especially in rural areas. So this measure would update the state laws on telehealth services to conform with federal Medicare regulations, require the insurance commissioner to report to the legislature on reimbursement claims in the previous year, and repeal the sunset date of Act 107, Session Laws of Hawaii 2023. So as our audience probably knows very well, Hawaii physicians frequently use telehealth, and it really does help us to better serve our patients. There are video telehealth appointments that can offer, a good alternative for our patients, especially our and audio-only visits do provide a very dependable lifeline to rural areas and underserved areas to access healthcare. So anyways, our patients who are elderly or on Medicaid or non-English speaking and have limited internet access really need to have an audio-only services for telehealth medicine. And there are a fair amount of patients that may be unwilling to consent to video visits. They want their privacy. It may not be culturally comfortable for them, and they prefer the audio only interactions. So for a lot of reasons, any restrictions on that can really limit access to care in Hawaii. So we did appreciate on this measure the changes of the health committee and including the extension of the sunset, and they extended it to not 1, but 2 years. And I think that was a very good decision made by our legislators. We do encourage further review because this is a moving target, as the federal rules change on telehealth, and we want to see how it shakes out all with the CMS changes. Then we'll be able to adjust better, I think, for Hawaii in terms of our telehealth rules. But for now, I think that this measure is good, and I'm really glad that that was successful. Did anyone have questions or comments? Did you want to comment on the telehealth measure? Mahalo to Matt Koenig and Christina Higa from the Pacific Basin Telehealth Resource Center, who really helped us with the nuances on this. appreciate their work with us on that one. We can move on to loan repayment, which actually didn't need to, oh wait, no, I'm thinking of the preceptor one. The loan repayment one went into the budget. That's right. Okay, I wanted to make sure I had that right. That's the measure that would appropriate funds for the healthcare, education, and loan repayment program. And that's a program that's been in existence in our state since 2012 and has gradually been expanded to a lot of different kinds of healthcare professionals, not just physicians. Although we have a critical shortage in our state, obviously we know that other healthcare professionals are also in great shortage here. So we're really glad that this has been expanded to other healthcare professionals and that this has been successful. We're also, this does help for the recruitment of physicians in Hawaii. We've shown that the percentages are high for those physicians and post-trainees who have been able to participate in loan repayment. They stay here. They work here, they become a part of our community. So this is a really important program. I want to say that Dr. Withy and the Hawaii Pacific Basin Area Health Education Center, we're so grateful for their support on this measure and for their continued administration with Department of Health on this program. Is there any other comments on the loan repayment bill? Okay, let's see. Let's talk about HB 1379, which is our foreign medical grads bill. This is the bill that changed the pathway or offered an alternate pathway. And we did appreciate changes that were made to this measure from CPC. There are new pathways that are emerging for licensure of physicians across the country. And the Federal State Medical Boards, FSMB, had released a very important sentinel document, and it actually only dropped right before the legislature. So we didn't have a lot of time with our stakeholders to kind of absorb all of the information on their recommendations. And this was a very huge lift advocacy-wise because it brought in AMA, ACGME, and all the other important players in terms of what they felt was important in terms of alternate pathways for licensure for international medical grads. I think that this measure will help it move forward, and we will still continue now that that document has dropped. We're going to have to analyze that further. I'm hoping that there will be some work groups that continue on to try to evaluate that further and find new ways to make sure that we're really licensing international medical grads. They bring a diversity of opinion about other healthcare systems globally to Hawaii. I think is really important. We do have some great programs that bring physicians from Asia, from the Philippines, and we really want to be able to license these folks so they can practice. There's such skilled physicians out there that we can use can serve Hawaii because we have such shortages. So I'm hopeful that we'll continue to analyze FSMB, and we're really grateful for the synergy with our medical board, Dr. Takanishi, Chelsea Fukunaga, who is the director, and also from our own HMA members, Dr. Russo and Dr. Ray Bautista of the Philippine Medical Association, who gave us some really good input on this measure. Any comments on the medical grads? And we went over the midwives. But I see that Dr. Jack Lewin has joined us, and I would just like to mahalo him. Thank you again. You weren't here when we were able to discuss prior authorization before, but we're so grateful for all your hard work on this measure with our policymakers. And fingers crossed, we have our work cut out for us, but we're going to continue to work together. Thank you so much for your hard work on this.
And you know what, we will actually accomplish much more than anybody thinks over time.
I think
Yeah.
Oh, that would be great. Yes. Oh, the cigarette tax. I'm sorry, I jumped over the cigarette tax. We had to talk over the cigarette tax.
Yeah, I'm gonna stop. I'm gonna stop.
No?
It's too expensive. No, seriously though, I think that the cigarette tax is important. It's just another bump up for us in that regard. But I think also that when we go back to the prior auth, there's something happened that was really amazing this year. The insurance community was vehemently opposed to the whole idea of the solution. At HMA, you guys have a nice relationship. It's not like we love each other, but it's like we're going to at least talk to each other cordially, and we're going to know what we each think. And I think that that helped. And I think beyond that, though, we hate to say that Brian Thompson life was sacrificed for this issue, but as United Healthcare CEO, that's not the kind of solution we want. But on the other hand, we now have a motivation, and I think that we're going to see this state is going to find a way to just move beyond problems of prior authorization, and we'll do that. It's going to take us a year to plan the whole process out. We're going to have the transparency because there's required reporting, SHPTA.
Yes.
And we will put that out. You'll see all the data and we'll know what claims were denied, how many were denied, by which plans, how many were challenged, how many were overturned. And, we know talking to doctors that people don't have the time to challenge. You've got to have like multiple staff working on this. So we're going to have to figure this out. And we're really grateful, though, that we're in a place where we can have this conversation together. Thank you very much, President.
Thank you. Do you mind if I just really quickly, I'll do the cigarette tax because I really wanted to touch on that in the synergy, but the HB 441 moved forward and it's increasing the cigarette tax from 16 cents to 18 cents. I'm sorry that I jumped over it earlier, but this is so important for Hawaii, smoking being the #1 cause of preventable disease and health and death worldwide. So I think that we brought together a lot of different groups on this one, state agencies, healthcare professionals, and HMA is grateful for the synergy with the UH Cancer Center, with Director Dr. Ueno. So that will conclude our report. I'm sorry if it took too long, but there was so much that I wanted to go over. I welcome any questions or comments from our audience.
All right. Well, thank you very much, Dr. Ignacio and Dr. Lewin. We're really grateful for the synergy and the leadership that we've had from our medical societies, the specialties, the University of Hawaii, the Med School, the Cancer Center, and we're especially grateful to our legislators, people like Representative Lisa Martin. We're very grateful for the health chair for the House, Representative Greg Takayama. It's his first year as health chair, and it's been great working with him and his team. And always grateful to Senator Joy Sam Buenaventura for her commitment, both, again, to health and her sensitivity to the neighbor islands. Representative Martin, we kind of put her on the spot today, and we're very grateful to her. She is also a doctor. She has a doctorate in public health, as I recall, from Columbia, as well as a master's in public policy from Harvard. She's a Kalaheo High School grad, if I recall, as well. And so we're very grateful to her for her expertise and her willingness to collaborate and be spontaneous with us. I want to take this moment again to thank everyone for joining us this evening. We know that you have your choice of activities. As usual, we'll be posting this on our YouTube channel next week. We'll make available any handouts that we have at that time. At this time, we're going to close out this formal part and continue our conversation here on site. Aloha and have a great weekend.